Mr. Secretary, good to see you here again today. And, I would just begin by just saying, for all the talk that our friends on the other side in the majority about, the problem of inflation, which is real for the American people over the last 5.5 months. In majority, they've actually contributed absolutely nothing in terms of real policy that could make a difference. Just a few minutes ago, the Bureau of Labor Statistics just announced their latest inflation numbers. It shows that inflation dropped to 4%. That's the lowest number in 2 years, 11 straight months. Again, we've got more work to do. And one thing that this Congress could do is to follow on the work of the Inflation Reduction Act regarding prescription drugs. As we all know, starting on January 1, because of the Inflation Reduction Act, the cost of insulin was cut by 2/3 for people on Medicare, which was authorized by that law. But what's not maybe as well known is that just a week ago, you announced more savings with a provision in the law requiring drug manufacturers to pay rebates to Medicare if the price of the product rises faster than inflation in Part B and Part D. HHS last week released a list of drugs in the Medicare Part B system for which drug manufacturers increase prices against the law, and that means that those drug companies have to pay rebates, which, according to your statement, could mean for patients and seniors up to $449 per dose of savings for 43 drugs. Now, if we wanted to do something about inflation in this committee, we could extend the benefits of those price negotiation rebates and insulin reductions to employer-based health plans, which we passed in the House when the Inflation Reduction Act came out of the House. Unfortunately, that was stripped from the Senate. So could you talk a little bit about the rebate savings? And again, there's a golden opportunity for us to extend those savings to working age Americans through their employer-sponsored health plans.
Congressman, absolutely. Everyone is now familiar with the $35 for a month's supply of insulin. Great news. Great news. By the way, I hear more from seniors about the shingles vaccine that is now free than about anything else, because the shingles vaccine could cost you $200 or $300. And for a lot of seniors on fixed income, that's not doable. Worry about getting shingles, because it is not fun. It is very painful. And so it's great that it's zero cost. But what we just announced is that we found that there were 43 drugs that pharmaceutical companies were putting out there where these companies had actually increased the new price more than the rate of inflation. And because of the new law that you all passed, we now have the ability to go back and say, you can't do that. If you try to increase the price beyond the rate of inflation, we get to pull back the excess and put it back into Medicare, so it'll provide savings to those Medicare beneficiaries.
And again, just to the point about our ERISA jurisdiction in this committee, I mean, there is nothing that really justifies not extending that same benefit to people who are not in Medicare. Isn't that correct?
That's right. In fact, we saw that companies, because the president pressured them, said you should be able to do $35 insulin, not just for those on Medicare, but for every American. And today, that's what we're seeing.
I'm glad you mentioned that, because you're right. A couple of the large drug manufacturers who produce insulin were almost shamed into, again, matching the $35 cost for seniors under Medicare. Again, this was a drug that had been off patent for over 100 years, and there was no justification for the overpricing that took place. So again, I hope, again, as the fruits of this law begins to, again, become more and more apparent to my colleagues, that we will revisit this issue of, again, extending this benefit so that, again, private health plans that provide insurance for people of working age in employer-sponsored settings will, again, also benefit from lower costs, helping reduce inflation in a really critical area which people depend on for life-saving medication. So I want to congratulate the department for their successful and swift implementation of the Inflation Reduction Act rebate program. With that, I yield back.